Well, welcome, Psychedelic Spotlight. My name is James, the Psychedelic Investor, and today we have a real treat for you. I am interviewing Dr. Ben Sessa, who is the Chief Medical Officer of Awakn Life Sciences. Awakn is a company that is working on tackling addiction in its different forms, from alcohol use disorder to even gambling addiction and other addictions that are both chemical based and behavioral based. So this is a extreme honor today to be talking to one of the leading scientists in the psychedelics field. So Dr. Ben, thank you so much for being on our podcast today.
Hello, James. It's a great pleasure to be here. Thank you very much for inviting me.
Well, it is a pleasure to have you. So I guess right off the bat, let's hop into it. Could you give us a top view over I can't speak today, and speaking is what I do for a living. Wow. Can you give us an overview of what it is that Awaken does?
So, Awaken Life Sciences is a biotech company. We specialize in both the research and development, but also the delivery of psychedelic medicines, principally for addictions, but also for a wide range of mental disorders. Um, we are a company that is based in many, many, many years of experience. Personally, I've worked within the sphere of psychedelic research for over 15 years, and I have put a team around me of, I am proud to say, the best, most experienced, expert psychedelic researchers and clinicians in the world. And this really comes from my 15 years experience in the field. We have an excellent scientific advisory board and an excellent clinical team. And so we feel we're in a very, very strong position within the industry to take forward our quest, which is to develop, research, and deliver psychedelic medicine to the masses for the large group of worthy and needy patients who could benefit from these medicines.
So let's start basic then. Primarily, Awaken's goal is to treat addiction in its many different forms. But I guess my first question is what exactly is addiction?
So there's many ways of defining addiction, and we have different scales and severities of addiction. Essentially, addiction is usually applied to addiction with substances, and this is when the use of a particular substance has become problematic to the point that it is causing dysfunction in a person's life. So just using a particular drug like alcohol or cannabis or even cocaine or heroin or opiates or any other drug doesn't necessarily mean addiction. It really becomes addiction when it starts to impact on your psychosocial functioning, it starts to cause mental health and physical health problems. And that's really when we talk about addiction. It's the repetitive use of a compound or behavior which results in a person becoming distressed and failing to function.
So, Awaken recently finished a pretty major clinical trial that was attempting to treat one specific form of addiction. In this case, it was alcohol use disorder, using ketamine assisted therapy and specifically your version of therapy, which you guys call CARE. Could you perhaps walk me through this clinical trial, talk about what the results of it were, and how important this is going forward?
Yeah, well, starting with the importance, alcohol use disorder is a huge public health concern. This isn't a small niche mental health problem. This is a problem that affects up to 40% of the world's population. Um, a significant number of people drink too much over the maximum recommended amount, and a significant number of people have very damaged lives as a result of it. At the far end of the spectrum, we have alcohol dependence syndrome, in which a person is physically dependent upon alcohol and has to drink every day in order to avoid withdrawals. And that's a very dangerous state to be in that can lead to mortality in a significant number of cases. But a much broader group of people, especially in these post COVID times, are simply drinking in a harmful way, which means above the recommended amount, which can lead to further problems. And of course, that group, which is large, as I say, 40%, are highly likely to move on to the dependent form. So, firstly, it's a major public health problem, costing millions, costing the health services, has huge impacts on society, on functioning, on family, on individuals, and is a massive burden. Now, the other thing about alcohol use disorder is after 100 years of modern psychiatry, our current treatments for this are poor. Um, the rates of relapse 12 months after the very best medical treatments we offer people are around 80 to 90%. That's an outrageous figure. I can't think of many other disorders within medicine that would accept that kind of poor outcome. So it's a very important medical problem to treat. And of course, it's not just a medical problem, it's tied up with culture and individuals and society. So it's a complex problem. So that's really why we did this study. Now, the CARE study is using ketamine-assisted psychotherapy to prevent relapse after a patient has become abstinent. So we take patients who are dry, so either they've just come from a detox or they've managed to reduce in the community gradually down to zero. In the CARE study, people were put into 4 different groups. One group had the CARE psychotherapy plus ketamine. Second group had placebo plus CARE psychotherapy. The third group had ketamine and education therapy. And the fourth group had placebo and education therapy. With the hypothesis that those that got the ketamine sessions together with the specially designed CARE therapy would be superior in their outcomes. And indeed they were. 86% of the people in the main treatment group were abstinent at 6 months, completely abstinent of alcohol. And
And
this
that's a pretty
compares,
groundbreaking result, correct?
absolutely, I mean, this compares to 2% before the trial. Now, this blows out of the water the current best treatments for alcoholism, which, as I said, are very poor. So it was a large trial, 95, 96 people across multiple sites. And it's really demonstrated that ketamine assisted psychotherapy with this specialist form of therapy is superior to placebo, superior to the current best treatments. Um, we saw a massive reduction in the risk of death from alcohol compared to those that are treated traditionally, and also very little in the way of adverse events for those people using the ketamine. So a very pleasing result indeed. And what this means is this was the world's first randomized placebo-controlled study using ketamine-assisted psychotherapy. So although people have been using ketamine in various different forms to treat addictions for a long time, this was the first study in the world that actually tested this in a scientific way. So very promising for the future for the treatment for alcoholism. And of course, the important thing about this now for Awaken is we're now in a position where we can deliver this form of therapy from our clinics. Um, there are a great
So
many. Yeah,
hold on
do
here
know.
for a second. Let's
Yeah.
I just want to make sure that I understand everything that you're saying here. So I'm just going to do a little bit of a recap and just jump in anywhere if I get anything wrong. So in our society, due to a bunch of different factors, cultural, also, the pandemic we're in, we have this massive problem with people taking too much alcohol. You said up to 40% of people at times in their life may be consuming what is considered an unsafe amount of alcohol. And despite this obvious societal issue, we just don't really have any good treatments for it. You said something like 2%. Was that the right number that you used? 2% of treatments are effective before this ketamine treatment. Do I have that number correct?
Um, 2% of patients were abstinent before they came into the trial,
Two.
compared to
Okay,
86%
sorry, I
at
misunderstood that.
6 months. So
So,
the very best treatments with traditional treatments for alcoholism, you might get around 30% of people abstinent at 6 months. So
so
it really does blow out of the water those very best treatments. And there's a great many different sorts of treatments for alcoholism. There's firstly detoxes, and then there's group therapy, one-to-one therapy, AA, rehab, psychotherapy of different kinds, all sorts of support mechanisms, anti-craving drugs, a huge mass of different sorts of therapies. But the outcome of all of those pooled traditional therapies still result in high rates of relapse at 6 months or 9 months or 12 months. So this particular study appears to be far superior to those.
So you guys in this phase 2 clinical study, you used psychotherapy combined with ketamine therapy and you received 86% abstinence rates. Another secondary finding that you guys had, which I almost found as more interesting and more telling when it comes to addiction, is the number of days that they succeeded without heavy drinking, or inversely, how many days they drank heavily throughout the 6-month period after the treatment finished. Could you just perhaps tell us how successful it was on that rating?
On that rating, I can't give you the exact figure. I don't have that in front of me,
Okay.
but it was a considerable reduction in the reduction in the number of heavy drinking days compared to traditional treatments.
Okay. We'll throw that up on the screen in the editing so people can see that because I
That
don't
would be
remember
great.
the exact figure either, but it was quite amazing. It was really a groundbreaking figure. But of course, you guys at Awaken, you're not only working on ketamine, you have a much more holistic approach to tackling addiction. You also are working with MDMA. So I was wondering, and I believe, if I'm not mistaken, that was your area of direct expertise, and you actually ran a clinical trial on this not too long ago. So I was wondering if you could tell us a little bit about what Awaken is doing with MDMA and addiction.
Yeah, so it was about 5 years ago that we started the MDMA study. I was very keen to work with MDMA. I'm triple trained as an MDMA, psilocybin, and ketamine therapist. And at the time, almost all of the MDMA work was being done on post traumatic stress disorder. And I wanted to go off piste a bit and try something new. As an addiction psychiatrist, I knew that trauma was heavily involved in alcohol use disorder. So we kind of put two and two together and thought, well, we can see that MDMA seems to be working well to treat PTSD. Let's see if it treats addiction. So we run a small open label pilot study here in Bristol in the UK, in which we took a group of patients post detox and we gave them an 8-week course of psychotherapy, which involved 2 sessions with MDMA, and then we followed them up for 9 months. Now, before we did that study, we did an observation study in which we just took a group of people in the Bristol area, um, and without any intervention, we saw how they did after 9 months with all the very best gold standard treatments for alcoholism. Now, in that observation study, around 76% of people by 9 months had completely relapsed to the same level of drinking pre-detox. Um, with the patients that went through the 8-week MDMA study, only 20% had relapsed. So this difference between 76% and 20% is massive. Again, completely overshadows the current very best treatments for alcoholism. Um,
Yeah,
and
I love something that you
MDMA
said
is a
there.
very
Sorry, continue. Continue.
Yeah, MDMA is a very, very effective tool. MDMA works to reduce the fear response that's associated with the recall of painful traumatic memories. So many people drink as a means of self medication to not have to experience the painful flashbacks and memories that go with a lifetime of trauma. And because of that, they cannot engage in psychotherapy. They hit a brick wall in psychotherapy where they just don't want to talk about their traumatic experiences. What we found that on MDMA, they surprised us and they surprised themselves in their ability to talk about their painful, often childhood abusive experiences. And in doing so, we're able to reflect and challenge these and then move forward without the use of alcohol. So this was a small pilot study. It's what we call an open label pilot study. In other words, there was no control group or placebo, which is what you have to do as a first step when you're involving a new drug with a new condition. Now, of course, what that means is that naturally leads on to a larger randomized control study in which we actually deliver placebo treatment alongside MDMA treatment. And that's the study that we're currently working on here at Awaken to run out of our Awaken clinics with a much larger N number and this placebo group to really demonstrate whether it's MDMA assisted psychotherapy that can create these very, very positive outcomes in terms of relapse, reduction of relapse.
So you talked there a lot about the role that trauma has in alcoholism, and this is extremely interesting because it seems to be one of the recurring themes of people talking about that I have on this show. Like we were talking to Numinous, who is of course using ketamine for depression, among other things, and he was talking about how trauma is often at the root of depression. We've had other people talking about PTSD. Obviously, trauma is at the root of that, but it seems like the potential of psychedelic medicines isn't necessarily in treating the whatever quote unquote like issue or disease, be it depression, be it addiction, be it PTSD. It's treating your inner trauma that is then reflected in a variety of different mental health conditions, be that addiction, be that whatever it is they are having. So it just seems like we have a real potential here of getting at the root causes rather than attempting to treat the symptoms, essentially.
Yeah, that's absolutely right, James. I mean, having been a psychiatrist for 30 years and seen so many different people with so many different psychiatric diagnoses, in the vast majority of cases, whether it's talking depression, anxiety disorders, PTSD, eating disorders, personality disorders, and all addictions, trauma does appear to underlie all of them, and very often early childhood trauma. And in a way, this makes sense. If you damage or hurt a child, you tend to hugely increase their vulnerability to mental health disorders later on. And in some ways, it doesn't matter which mental disorder. One of the things we're doing with psychedelics is we're really tackling the concept of categorical diagnoses. If you damage or hurt a child, they may develop a PTSD, they may develop an eating disorder, may develop anxiety disorder. And one of the problems I think with modern psychiatry is we have this papering over the cracks with maintenance therapy approach. So we treat the symptoms. We give them antidepressants if they're low. We give them mood stabilizers if their mood goes up and down. We give them hypnotics if they can't sleep. We give them antipsychotics if they become paranoid. And this is a little bit like applying a sticking plaster without actually mending the broken bone. And the broken bone is the trauma. And so in many ways, psychedelic therapies are a whole new paradigm, a whole new approach to using clever, focused psychopharmacology um, connected with psychotherapy to provide effective courses of psychotherapy that get patients better from the inside out, and then they don't have to sit lifelong on these medicines that just paper over the cracks. So traditional psychiatry is like breaking your leg, and instead of going to the orthopedic surgeon and having the bone fixed, you just wobble around on a broken leg taking painkillers for your whole life. That's sort of how we approach psychiatry and have done for the last 40 or 50 years. Psychedelic therapies are a radical paradigm shifting approach. It's a lot more like surgery in a way. It's an intensive, high energy, upfront piece of work that gets the patient better so we can discharge them and we don't have to keep them in our care for the whole of their lives, which is obviously the right thing to do for patients. And it's also the right thing to do for public health. So psychedelic therapies are really a new way of looking at mental health. And I'm quite convinced, and that those of us in the field, that this really is going to transform the environment for mental health services and public health care long into the future.
So, Dr. Sessa, sorry, you are one of the world's leading uh, advocates, scientists around psychedelics. So, I have to wonder, do you have any personal experience with these substances?
Indeed, I do, James. And even though I'm a medical doctor and I work with patients, and there are very strict rules about doctors breaking the law, I'm in a very fortunate position. I think I'm one of the few people in the world who can say on record that I've taken MDMA, psilocybin, DMT, ketamine, and LSD. Most of those intravenously injected into me. And this is because, as well as administering these medicines to patients in research trials, I've actually been a healthy participant in these research trials because I've been in this field a long time. I've been in this field over 15 years and worked on neuroscientific and clinical studies at Cardiff University, Bristol University, and Imperial College London, and the Maudsley Hospital in London. And so it's been a great pleasure to do this. And I think it gives me a tremendous sense of insight into the subjective experiences of these drugs, which can only be a good thing for reassuring my patients and also for me to understand those mental spaces. These are very, very safe drugs. They are irrationally banned under drug policies and drug laws around the world, but indeed, they're actually very, very safe and they can be delivered very safely, especially in a clinical context within a controlled medical environment. So, yes, I'm very pleased to be able to say I have had those experiences and they've all been very positive and they've strengthened my experience and confidence in using them with my patients.
Do you think that they have changed your personality or your outlook on life whatsoever?
That's a very good question, and it's a chicken and egg situation because in many ways, the sort of people who are interested in psychedelics often already have that kind of curious, outgoing, esoteric approach to life at the best of times. They certainly remind you that there are more than just this waking state of consciousness, and from a clinical point of view, what they've certainly done is they've shown me that the psychedelics' ability to shake up the brain, to tackle rigid narratives, to make you look at old stories in new ways, um, it certainly taught me that what a wonderful tool that is for patients. Now, I have a good attachment relationship. I'm a positive, happy, outgoing person. But if my head was full of narratives of I am useless, I am a failure, I am hopeless, I am worthless, a medicine that for a few precious, privileged hours allows you to say, do I have to be those things? And then rebuild, reboot, rebrand, defrag those old narratives and build up these narratives in a new positive way, which is why we do the psychotherapy alongside them. It's the holy grail of psychotherapy, to be able to shift these rigid patterns of thinking that underpin lifelong mental disorders. So I can really see how these powerful tools can be helpful clinically.
So let's maybe take off the doctor's hat for a second and put on the hat of somebody who has experienced these medicines firsthand. Do you think that there is any chance that, or let me rephrase the question differently. Do you think that what is happening is completely the result of chemical reactions happening in the brain? Or do you think that there could be something deeper that we don't necessarily understand through our scientific lens happening at the moment? Or is everything completely understandable, even if we don't understand it at the moment, through a lens of neurochemistry?
Well, I mean, this is very much a philosophical question, isn't it? The extent to which we consider a material reductionist point of view. At one level, everything is chemistry and electricity, whether it's love, spirituality, or whatever. We are physical beings living in a physical brain, managed by chemistry and electrical activity and hormonal activity. But actually, what's interesting about psychedelics is they really are very holistic in the way they work. Just taking a purely biological viewpoint will be missing the point. There's no point in us chemically and biologically altering a person's brain if we don't also pay attention to their social environment and their psychological environment. We're not just into chemically fixing brains. That's been one of the problems of the last 50 years of biological society. We're interested in the patient's relationships, where they live, what their aspirations and dreams are, why they've become unwell, what their relationships are with their family and their children. And unless we pay attention to all of these aspects, they're not going to get better. And that's why at Awaken Life Sciences, we have this combination of both biological research and development, but also the concept of clinical delivery through a series of high street clinics. And there are no other companies in the world that are doing this to the same extent as Awaken. There's quite a lot of biotech startup companies who are making this drug or making that drug. But the reason we're opening a string of clinics, and we're looking to open 20 to 25 clinics over the next 5 years, is not only do we want to develop and approve these medicines, but we want to be the high street presence where you can actually go and get this psychotherapy. And we'll never just be delivering the drugs without the therapy. There's quite a lot of so-called ketamine clinics around the world that just infuse ketamine as an antidepressant with little or no psychotherapy. We don't do that. We use the ketamine to put the brain into a state of growth and development in a very narrow therapeutic window. And when it's in that therapeutic window, that's when we use the psychotherapy to address the psychosocial issues in the patient's life. And this is doing much more than just an antidepressant effect. This results in a lifelong transformative experience in which the patient can tackle these negative, rigid narratives and actually move on, get better, and dare I say it, be cured. And that
It's a big
word,
word.
it's a dirty word in psychiatry, cure, isn't it? It's almost as if in psychiatry we've become used to being these palliative care type doctors. We don't cure our patients, we just patch them up with daily medications that you have to take for weeks, months, decades, just to keep the symptoms at bay. We believe that with psychedelic assisted psychotherapies, we can actually get to the root cause, as you described, the trauma, sort these things out, get them better, discharge them, and never have to see them again because they're leading productive lives and back in society. So it really is about transformative change. And this is why we're very excited about this direction.
So you do think that it is really a one and done type thing. If I'm somebody that has severe gambling addiction or severe alcohol addiction, go through. I forget how many treatments you guys offer. It's 3 or 4, something like that.
Yeah,
Correct?
it's 3 in one of the protocols and 4 in the other in terms of ketamine
Okay.
sessions.
S- So I finish that protocol, and then the goal is that I'll never have to do it again. There won't be like a yearly or biannual type of checkup where I get a ketamine infusion to just kind of get me back to where I was originally.
Yeah, that's a really good question. You know, when you come up with something innovative like this, the eyes of the world are on us to produce magic bullets that work completely first time every time. It's a lovely aspiration, and I'd love to think that's the case, but it probably won't be the case. There's no reason why we shouldn't repeat them. There's many different sorts of
Mm.
medical interventions that you repeat. If you have a treatment of chemotherapy for cancer and it doesn't work, you do it again. So there's no harm in having to repeat if we have to. Um, we're only open relatively recently, so I can't really give you any long-term outcome data, but certainly our goal, if not, we're not going to be a magic bullet. Patients may require top-up sessions, maybe once a year, once every 6 months. But what we don't want to do is we want to avoid becoming a long-term maintenance therapy center like these other ketamine clinics. We do want to try and affect a lasting transformative change that means the patient makes these realizations about themselves and gets better.
We
But
might
you're
have
quite
lost you
right.
there a
We
little bit,
may
Dr.
need.
Sessa. I don't know if you can hear me at the moment, but your screen has frozen, unfortunately.
I can hear you now. Can you hear me?
Yes, you are
Can you
back
hear me?
already.
Yeah.
I
Okay.
can, I
I'm
can.
sorry
We
about
got
that.
most
Yeah.
of what you were no worries. I guess just last question though. Could you talk to us a little bit about what is in the near future for Awaken? So let's say the next 5-year time horizon.
Yeah, so we are pushing ahead with the opening of clinics. Like I said, we so far have 2 clinics open, one in Bristol and one in Oslo. We have a program of opening further clinics in Norway and throughout the Nordic region. We are opening a London clinic in the next few weeks. We're opening a Manchester clinic in the UK later this year, with the goal to open 20 to 25 clinics over the next 5 years. And what's important about the clinics is um, we are not calling them ketamine clinics. We're calling them medical psychedelic clinics. At the moment, ketamine is the only licensed approved for psychedelic there is. So that's what we're using. But it's very much a case of ketamine now, MDMA and psilocybin coming soon. So what by getting the clinics open and establishing ourselves on the high street, we hit the ground running when new medicines get approved, and we will be the go-to place for ketamine for psychedelic medical care. So that's the delivery part. Within the research part, as we've discussed, We're pushing further with the CARE study into a phase 3 study in order to have ketamine-assisted psychotherapy licensed as an approved treatment for alcohol use disorder. We're pushing ahead with the MDMA study, with a randomized control study, to eventually see MDMA-assisted psychotherapy as a licensed approved treatment for alcohol use disorder. And we're doing some very exciting things with new molecular development, new chemical entities, as they're often called. We have a superb scientific advisory board led by Professor David Nutt, Dr. Sean McNulty, and Professor Celia Morgan, who are all world-leading experts in the field of psychedelic research and drug development. The concept of novel MDMA, that's what we're aiming for. We're trying to develop molecules that have the same entactogenic qualities as MDMA. In other words, very good at switching off this amygdala fear response and allowing for trauma-focused psychotherapy. And MDMA is a great pleasure to work with, but it is a little bit unwieldy in a clinical setting. It's a sort of 6 to 8 hour experience. What we're trying to do is to design new, completely unique chemical entities that can work in the 2-hour period, like ketamine does, which would make them much more clinically deliverable. Now, clinical deliverability is important because we want to increase access to psychedelic medicines all over the world. And certainly groups like the NHS in the UK would find shorter acting molecules a lot more attractive from a financial point of view when developing clinical protocols. So there's a lot of creativity going on within the company. We're also developing treatment training platforms for psychedelic therapists and clinicians, because we recognize there's going to be a bit of a bottleneck in coming years as more psychedelic therapies become available, but there's a lack of clinicians to deliver them. So we're developing training systems, ecosystems, digital healthcare systems, which will allow patients to monitor their own health issues, which allow us to develop our programs more effectively. It's a very exciting time over the next 5 years. I think an important thing as well is to try and move this away from privately funded care into public health care. In the UK, this is particularly important because we have the National Health Service. We're very keen to move towards that and to encourage the NHS to take up our treatments. I think they will. Psychedelic medicine makes great economic sense. There's nothing more expensive than an untreated psychiatric patient. They cost an awful lot of money over the lifetime. And so although these treatments may seem expensive up front, they actually make great economic sense. And it's false economy to not treat psychiatric patients effectively at the beginning of their psychiatric career, rather than allowing them to become chronic lifelong patients. So we're very, very excited for the future of Awaken Life Sciences and the whole field of psychiatry and psychedelic medical healthcare.
I just want to ask one follow-up question on that. You mentioned the NCEs. I want to get your opinion if you believe that the future of psychedelic medicine, if we fast forward 5 years, 10 years, if the future of psychedelic medicine is going to be completely new drugs, maybe based on classical psychedelics, but new entities that we don't even really know exist or the public don't even really know exist? Or do you think that in the psychiatric space, there will always be room for your traditional LSDs, your traditional MDMAs, psilocybin, etc.?
I think there'll be room for both. Absolutely. The old ones are not going away. You know, there are some people within the psychedelic community who are fearful of us making changes to these old ones. And my answer to those is, well, no one's taking away MDMA, LSD, psilocybin. They're always going to be there. And if they're useful and beneficial and safe and effective, we're always going to use them. But, you know, psychopharmacology is a dynamic, fast-moving service. It's we think of how many new drugs we have today compared to 100 years ago. There's nothing wrong with developing new drugs that treat symptoms more effectively and safely. There's also a lot of argument around some people who are developing drugs that take out the entire psychedelic effect of them. And some people find this a strange thing to do and say this isn't psychedelics. Well, I personally have nothing wrong with that. That's just creative pharmacology. If it turns out we can produce a type of MDMA, a type of LSD, a type of psilocybin that doesn't have any psychedelic effects, but really helps with some form of symptom, why not? That makes it more accessible. And no one's taking away those old drugs. So, in answer to your question, yes, I think there's going to be a lot of new chemical entities in the future. But I don't see any reason why this would mean we would lose the ones we've already got. What we're going to do is develop better, safer, more effective ways of using drugs like LSD, psilocybin, DMT, ketamine, MDMA. So the future's very, very optimistic.
Perfect. And with that, I guess I will let you go. Do you have any final words, anything that you want people to know about Awaken or your work personally, before we let you go?
Yeah, I mean, what I'd like to say about Awaken Life Sciences is the whole field of psychedelic research and medical healthcare has changed beyond recognition in the last few years. I've been in this a long time, and for many, many years, we were scraping around for a few £100 here or there to do research studies. What's happened now is this huge growth of an industry. And some people fear this and talk about the corporatization and medicalization. I don't fear this at all. I see this as an opportunity to increase accessibility. Psychedelics have been around for a very long time, but they've been the plaything of the very fortunate and the very rich. I have a great many patients out there with unremitting mental disorders who are being failed by traditional treatments. I'm all for the development of services like Awaken Life Sciences. Our primary goal is to increase accessibility to these medicines to more people because we can see the lack of safety and inefficacy of current traditional treatments. So it's all about building the best scientific board around us, building the most experienced clinicians, and developing a service for the people that can be rolled out to mass public health. That's very much our goal, and we believe we're in the strongest position at the front of the pack to do that. So it's a very exciting place to be working. And for me, a very much great sense of personal validation, having working for so long in this field and feeling something of a maverick or a pariah. There's nothing maverick about this. Psychedelic healthcare is where we are with cutting edge medicine. This is not just some fringe subject. Every single major health institution in the world now is running psychedelic research. It's very much where we are with cutting edge neuropsychiatry, and it really will be the future of medicine.
Perfect. And with that, I will just thank you one last time for being on the podcast today. Where can people learn more about Awaken?
Certainly, you can go to the Awaken Life Sciences website, where you can see both the corporate website and all the work we're doing in terms of our research and development. And then there's a separate clinics website where you can read about the clinics that we're opening and the ones that are open, and also how to refer patients to that and come along to Awaken Clinics and get treatment with psychedelic assisted psychotherapy.
Perfect. I hope everybody enjoyed this episode, and we will see you next time.